Everyone, so today in this video we're going to go over part 2 of my ALS awareness. All right, and this is going to talk a little bit about the diagnosis and other things of that nature. So as we talked about a little bit in the last video, there's no single diagnostic tool for ALS. It's a series of clinical procedures that are conducted to rule out neurological conditions and pretty much figure out what closely resembles to the disease and try to rule it out. The diagnosis can typically take up to 12 to 14 months. And that's a very long time to come up with the diagnosis after running all the necessary tests and things of that nature, and it's a little silly, to be honest. They hope to expedite the process by developing tools that indicate whether people have the disease or not, which is great, but that's only a hope. That's not solid. What are they doing to expedite it? Some neurological diseases share the same conditions. To distinguish them, clinicians run tests, which these tests can include an electromyography, or an EMG, and nerve condition studies. All right. These tests enable clinicians to check whether motor nerves are plugged into the muscles and are working properly. NCS tests whether the motor nerves can send signals, of sufficient strength to enable movement of the muscles. EMG measures the abilities of these muscles in response to these signals to trigger contraction. These tests help rule out certain disorders, including those of the peripheral nerves. Another test that the clinicians run is also called muscle biopsy. Clinicians may also recommend a biopsy to further investigate affected muscles. Examination of muscle tissue under the microscope can help rule out certain muscle diseases. As we talked about before, a lot of the stuff that deals with ALS, a lot of your symptoms are going to include a lot of muscle failure. So these are muscle biopsy is one thing that they use to decide whether or not it is part of ALS or just part of something else. Another test is what they call magnetic resonance imaging, or an MRI as everybody knows it. It enables clinicians to peer into our organs and our tissues, including the brain and spinal cord. MRIs can help rule out a number of conditions, including brain tumors, multiple sclerosis, and certain disorders of the spinal cord. And also, another test that they run is genetic. Of course, that one's a given. They want to see if it runs within your family, to see what type of risks you may possibly have of getting this disease. So what they do is, most cases of ALS, they're sporadic in nature. About 10% of cases, however, are inherited. And remember that 10% of what they know right now of all ALS cases are inherited, which means they're genetic. When a familial case of ALS is suspected, genetic testing must also be recommended. Commercially available tests can identify alterations in 9 ALS-linked genes. So, if you have a family member that has ALS or had ALS, it would be smart, especially if you're there within your direct blood, get yourself tested. Find out now if it's possible to do it. Like I said, 12 to 14 months is a long time for a diagnosis. You might as well try to rule out things as soon as you can. Other tests can include blood tests, urine tests, and even a spinal tap. But let's be honest, not a lot of people want to do a spinal tap. It can be painful, but the pain may be worth your life. During this process, people with ALS might receive a diagnosis of suspected possible ALS or probable ALS. All right? These designations depend on which parts of the body are affected by the disease. Without a definite diagnosis, people with possible or probable ALS nevertheless remain eligible to participate in a growing number of clinical trials evaluating emergency treatments for the disease. So look up some clinical trials if you think you may have it, or if you may be in danger of having it. Look up some clinical trials that they do. See if your insurance covers it. See how much it'll cost, co-pays, whatever the case may be. People, this is your life you're talking about. This is other people's lives in your family that you're talking about. I'm sorry, but somebody's life is more important to me than any amount of money it may cost for medical bills. I'm willing to sacrifice that to make sure that my family is okay, and I hope you would be too. Some of the emerging tools that they have that they use for this is a growing number of researchers, they suspect that MRI that might help to do much more than exclude other diseases. Certain brain scans might indicate whether a person has ALS. Now, it's certain brain scans, not all. But MRIs, as you know, that they allow the doctors to see much more than what's on the surface or what's slightly under the surface. Researchers hope these signatures, called biomarkers, can be used to identify people who are at high risk of developing ALS before they develop the disease, right? Meanwhile, other scientists are developing a new method called electrical impedance myography, or EIM, to diagnose ALS. This test helps identify key changes in affected muscles, including atrophy. Scientists hope that this tool might also predict the spread of ALS and help them to develop treatments for the disease. That's going to come to the end of video number 2 here. Look, as I said before, this disease, it's horrible. It's never fun to watch anyone, let alone a family member, have to struggle through these types of diseases. Any disease, any struggle. It's never fun. It's always hard. But understand that the more you know, the more prepared you are for what happens or what could happen. The better prepared you are to help them, the better prepared you are to maybe give them options or get them out to get all these tests done if they refuse. Some people just may be too prideful to think that there's no way that they can be this sick, or that there's no way that the doctors are right, and not be willing to go through any further testing or to go through any further trials or whatever the case may be to try to cure this disease that they have, or to try to further explain why or how they got it. People, this is not a joke. I don't make these videos just for kicks. There's no way I can. I can't make this stuff up. Like I told you, I'm reading it right off of a paper that I got from the internet. Is it a little bit copyrighted? Yes. But what information nowadays isn't copyrighted?